Hi everyone. I found this fascinating. I've already seen aspects of the work we're doing in the two presentations we just saw. I'm Felicia Lassk in the marketing group. My colleague is Yang Lee in SKIM. And we're also working with pharmacy, Nate Rickles from School of Pharmacy. And I wanted to thank Dean Courtney as well as Associate Dean Platt for bringing us together to be able to talk about our research and get ideas and collaborate together. And I'd also like to thank Dean Reynolds from the School of Pharmacy, who really was instrumental in bringing our research team together. This is an interdisciplinary project that actually came about from another Northeastern University event, which was the CEO Breakfast, where we had the CEO of CVS. And it was great. I was watching, drinking my coffee and watching as it screened over the internet. And I thought, oh, these are some ideas that I was looking at in my sabbatical research. And so I contacted Dean Reynolds, and we were able to get a meeting together and kind of look at some of the research that Yang and I have started in healthcare, looking at collaboration. And so we wanted to look at, that research is looking at collaboration in the emergency department, primarily focused on nurses. And we're working with Carol Kenner in the School of Nursing. And this is looking at more, originally, looking at more one-to-one relationships between the pharmacist and the customer or patient. And so that's kind of how this research got started. Some of the drivers of the study are looking at the outcome being medication adherence. And we wanted to look at something that was important that really can make an impact. And we're lucky to have Nate Rickles on our team. He is an expert in this area. And we can think about the impacts of medication, about taking your medication. There's a variety of reasons why people don't take their medication. I'm sure if you've ever looked at some of the side effects on the package, it's a little scary. Just monetary concerns, or even just not strong communication between the physician and the patient on why the medication should be taken. And not taking medication can really lead to some adverse outcomes. And so it can be things such as a medical emergency or a severity in the disease that someone has, hospitalization, rehospitalization, or sometimes even worse. And so looking at the decision that you're making in terms of whether or not you take your medication has personal outcomes, but it also can impact the healthcare system. And so this was a study that was done in 2012 that shows the cost to, this is US, annual costs can range between $100 and $289 billion. So this is a huge issue that's of concern in how can we help people increase taking their medication for both themselves personally and then societal costs as well. And interestingly, along comes regulation. And so now, based on Medicare and Medicaid, pharmacies now are responsible for the percentage of patients that actually adhere to their medication. So it's important to the pharmacist and the pharmacy based on standards as well as reimbursements, what percentage of their customers actually adhere to their medication regimen. So it's an important issue. There's also a huge change in the business plan of the pharmacy. And so this is interesting from Tim's perspective. You think of going to the pharmacy more as a transaction, and so we're now seeing a shift more to relationships. This could be dealing with access to medication or medical information. So there's a shift again to look at how can we have the pharmacists work to their potential. So instead of just being behind a desk dispensing medication, the idea is that pharmacist's role is now focused more on being a consultant and a collaborator with the patient to help them adhere to the medication regime. And this is something that's really of interest to Yang and I because of our interest in healthcare collaboration. So we're really interested to see how does that collaboration between the pharmacist and the patient, how can that be improved to enhance medication adherence? And of course, we're also interested in technology. And so there's a variety of new technologies that deal with healthcare solutions. So we want to look at those issues and see how, what kind of technology is out there. So we're looking at platforms, but we know electronic medical records, we get reminder calls from the pharmacy. MedSync is something that's really been positive in helping increase medical adherence. There's an app for that to remind you to take your meds, and there's wearables. So there's a lot of technology. This is a quick aside. My doctor actually left medicine to go work for an app company. So that's a promise there. And like, she can barely handle an email, but she's there for her medical knowledge, so it's good. So looking at technology there. So our real focus in this research is collaboration. And so we have two areas that we're looking in. So Nate is wonderful in that he's actually developed a healthcare collaboration model. So we're using that model, and we're able to tie that and look at that in a telehealth environment. So our work with the nurses, we've really focused on face-to-face. I mean, we're in the emergency department, where the face-to-face information is really critical. And here we're able to look at using technology, software as a service, and using that technology to work and collaborate with patients. And so the healthcare model looks at a variety of tools such as, who the patient is, what disease they have, what medications are they taking, what are previous interactions that they've had. So taking these factors and looking at how does that impact the interaction, the communication, the collaboration with the service provider, in this case the pharmacist. And so looking at kind of this iterative process of being able to get patient feedback and be able to go back and forth and collaborate, and leading to positive outcomes such as patient satisfaction and what we're really interested in, medication adherence. So how can we improve that? So Nate's model actually lets us look at that. And how we're able to tie that into technology is we're able to look at a company called Anthurium Solutions, Poet Solution. Let me just get the exact terminology here. I am not the tech person. Poet is Pharmacy Outcome Enhancement Technology. And this is a technology platform that both optimizes and orchestrates consultation and collaboration between and among the patient and either their formal or informal caregivers, and the goal being to provide some type of solution. So solutions we're looking at are, say, managing a chronic illness such as diabetes, or in this case, in particular, managing medications. So it's a technology platform that we're using to be able to access and look at these collaborations. So this is actually lets us look at collaboration in a virtual environment. So what are we doing? We're just getting started. We've had several meetings, and so we're really excited about this opportunity to explore collaboration in this environment. We have a variety of methodologies that we think we can look at. We're starting off first with a case study, and so we're working with Anthurium to look at that in the Poet environment. But we see an opportunity for a variety of other studies that we could focus on, looking at both individual and collaborative data, looking at both cross-sectional and longitudinal data. So we think we really have a wealth of opportunity here to really do a deep dive and understand how healthcare collaboration works in this environment. And again, our overall goal is to understand how interpersonal collaboration and technological innovation can increase customer adherence to their medications. So with that, I'm going to open it up for Q&A for the whole panel.